How to read x-rays for x-ray rounds. If you are a student on orthopedic surgery, you may be asked to read an x-ray out loud in front of everyone. This can be a little bit intimidating experience, so I made this video to help you have a framework to read these out loud. So let's go through them step by step. Here's the framework. Follow along with me. We'll call this talk Crush X-ray Rounds. Now, when you get called on, the first sentence that you speak has to be very clear. And the first sentence has three parts. First part is what view are we looking at? Usually AP, lateral, or oblique. The second part tells us, is this an adult x-ray or a child x-ray? And the third part is what body part are we looking at? All right, so the first thing out of your mouth is a description of the view that we're looking at. And AP, which stands for anterior posterior, just think about someone just looking directly into the camera. A lateral would be someone in profile. The anatomic lateral view is someone in profile. And if it's somewhere in between, that is an oblique view. So let's look at these knee x-rays. Here is an AP, or anterior posterior AP. The lateral, you imagine someone standing to the side. And an oblique, so the guy sort of rotated 45 degrees. Same thing with the foot. Here is the AP. Here is the lateral. Here's the oblique. So if you see this x-ray, you're going to say this is a AP view. It's the first thing out of your presentation. Elbow. If you see this, you say this is an AP. This is a lateral. This is an oblique. And on and on. This is a wrist. AP, lateral. This is an oblique view. Hand, the same thing. Now there are some special views. There are some special views that you should know the name of. Now the ankle has a very special oblique that allows you to look down the joint of the ankle. So if you look on this true AP view, there's a little overlap between the fibula and the talus here. If you look at the mortise view, which is a special oblique, you can see the entire joint. And the mortise comes from some woodworking term, in which you have a square part of the wood that joins with the corresponding U of the other side of the wood. So we call this a mortise view. So if you see this, you would say this is a mortise view of a blank, blank, blank. This is a shoulder, and there's a special view where you turn the patient sideways, where the scapula or the shoulder blade, this is the blade of the shoulder blade, the components come down to a Y. So we call this a scapular Y. You don't need to know all the details of what is there so far. As long as you say this is a scap Y view, you'll be ahead of the game. There's a special knee view in which you will shoot down the front of the patient's knee, and it looks like a sunrise. So you don't know those old pictures of little kids would draw the two hills and the sun coming up. Well, we call this a sunrise view. Technically, this is a merchant view, but if you call this a sunrise view, you'll be crushing x-ray rounds. The hips are difficult to shoot lateral, so there's two ways we do them. So one is a frog leg, so you have the patient externally rotate the hips, one or both hips, and you can get a lateral of the hip shown here. Now, one thing to notice, the pelvis is an AP. The hips show a lateral view of the hip. So this is you would say this is a frog leg lateral of one of the hips. The other way we get a lateral of the hip is that we move the other hip out of the way. The problem with getting laterals of the hips is that the other leg's in the way. So what we do is we lift the other leg, we shoot at this sort of oblique angle, and we get this view, which is a cross table lateral of this hip. All right, so now we got this first part. So the first thing you're going to say is this is an AP lateral oblique sunrise view, scap Y, etc. The second part we usually specify, is this a child or an adult? And we refer to their skeletal maturity. What you are looking for are growth plates. So here on the left is an adult pelvis, or an adult low pelvis to be specific, but an adult x-ray. The femur is all one bone. The pelvis is all one bone with some regular joints. Now look on this one on the right. If you look at the femur, there's a space here. There's a space here. There's a space here and here. Is that a fracture? Well, no, those are the growth plates. The growth plates or physis. So this is the physis. There's another physis here. If you look on this adult, the physes have closed completely here. And even here in the pubic rami, there's an open physis. So if you're looking at this side, we'd say this is an AP of a skeletally mature, and on and on. On this, we'd say this is an AP of a skeletally immature patient. Looking at the knee, on the left is an adult knee. So we'd say this is a skeletally mature patient. On the right side, you see this line here, you see these lines here. These are not fractures, these are growth plates or physes. So the physes are open. We call this a skeletally immature patient. Same with the ankle, the adult on the left. You see these physes open. On the right, this is skeletally mature patient. This is a skeletally immature. Skeletally mature. Shoulder. You see this open growth plate and the proximal humerus. So this is skeletally immature. Skeletally mature. What's interesting, you can actually see this line, which is what we call the physeal scar, but that is completely sealed. Here's an elbow. Elbow on the left in this adult is an adult. There's 3 bones, the humerus, ulna, and the radius. On the right, you see looks like there's many bones, but these are just open physes. Skeletally immature, skeletally mature patient. Looking at the wrist, so on and so forth, and you will get pretty good at identifying growth plates. All right, so let's review. The first thing you're going to say is AP, lateral oblique, X-ray of a skeletally mature or skeletally immature. And now we're going to go through the body parts. So if this is an X-ray of an entire skeleton, imagine we're zooming in on one particular part of it. So if we zoom in on a joint, like say the X-ray just shows this part here, we're going to call that an elbow. If we zoom in on this joint, we call this a wrist. If we zoom in on a X-ray that shows multiple joints, well, we're going to refer to the bone that it's covering. And I'll explain more in the next few slides. So this is a shoulder. This is an elbow. And if you see this, well, we see a shoulder and we see an elbow. It can be a bit confusing. What do we call this X-ray? Well, we usually call this the name of the bone that it's focusing on, in which case this is a humerus. So if you were in X-ray rounds and you saw this X-ray, you would say this is an AP of a skeletally mature, because all the growth plates are closed, skeletally mature humerus. Here's a view of a wrist. AP lateral oblique of the wrist. And here's an X-ray of the wrist is seen, the elbow is seen. So you can't say wrist, elbow. You would say the bones that it is focusing on, which would be the forearm. For some reason, we call this a forearm. So this would be an AP of a skeletally mature right forearm. Hands and feet have a little bit of its own nomenclature. Since it's beyond a joint, you would say hand. And if they focus in on one individual finger, you simply say finger. So this one would be an AP of a skeletally mature finger. This is an X-ray of a hip. As we talked before, this is a cross-table lateral of the hip. It's cross-table because the pelvis is also in the lateral. Here's a knee. And there's a hip and a knee. What do we call this X-ray? Well, we call it by the bone that we're focusing on, which in this case is a femur. Here's a pelvis. So you might be tempted to say this is hips. We actually, since we're focusing on this pelvic bone, we're going to call this a pelvis. Again, if you see these, We're going to refer to these as ankles. If you see the knee joint and the ankle joint, we're going to refer to this as a tib-fib view or tibia-fibula view. We usually call it tib-fib. Same thing with the foot. If you see the entire foot, you can call this a foot x-ray. So let's do a couple of examples. So you're in x-ray rounds and this x-ray comes up and they ask you to read it. Well, what's our 3-part framework? The first part, this is an AP, lateral or oblique. What we call this a lateral. This is a lateral view of is this a kid or an adult? A skeletally mature knee. So lateral view of a skeletally mature knee. And your first sentence is done and you're well on your way to impressing the guys in charge. Here's another example. I'd like you to do it in your head first. So they call on you and the first sentence out of your mouth will be, this is a lateral view of a skeletally mature right elbow. Let's do another one. Here is an AP view of a skeletally mature knee. So I think you get the patterns. Here is an AP view of a skeletally mature shoulder. Then you go on to describe the pathology, which we'll get into in another talk. On this x-ray, again, this is the first sentence you're saying. The first thing you say is, this is a lateral view of a skeletally mature left hand. Here is a AP view of a skeletally immature, because these are all growth plates, skeletally immature pelvis. Give you a second to come up with your own answer. This is a mortise view of a skeletally mature ankle. Here is a cross-table lateral of a skeletally mature hip. It's cross-table because this pelvis is the lateral view. This is not the AP of the pelvis that we saw in the frog legs. In your mind's eye, this is a lateral of a skeletally immature right elbow. Describe this x-ray. This is an AP of a skeletally immature ankle. So that's step 1 of reading x-rays and x-ray rounds. Once you get that first sentence, now we're going to move on to describing pathology. So in the next video, we'll explain how to find a fracture or a dislocation and how to describe that fracture in detail.